Hey guys, so I just finished cleaning up and I'll be going to see the eye doctor today. I don't know, I've been using the phone for a long period of time, and so this eye is beginning to have like a little bit of concern, so I have to go check up my eye and see if everything is okay. So I'm hoping everything is okay, because it's been watering, and then there is a little thing here. Just don't want to call it a name, because when you start calling this thing's name, they just stick and start becoming that. Because I know words are really powerful, so I try not to say anything. So that's it. Let me just go get ready and see you in a bit. Get very anxious when I come for a test. Like my heart beats. Oh my god.
Audio as well. Okay, can you place your chin there? Okay, make it for it. It's appropriate to have your eyes checked once every year. Okay, what's the need? Why should I do that? It's important to have your eye checked because number one, the biggest problem is the silent thief of sight. We call that glaucoma. Okay, glaucoma is a disease that just sits in the eye, doesn't cause pain, wouldn't cause redness most of the time if you have the very high pressure type of glaucoma, the open angle type, and you wouldn't even know that your vision is being affected until it's very late in the disease process, at which point blindness has set in. And unfortunately, the kind of blindness that glaucoma causes is irreversible. So that's why we need to heighten awareness for ocular checks, frequent, regular ocular checks. For glaucoma, it's important also to note the risk factors so that you know whether you belong to the very high risk group or you're just moderate risk or none at all. For the high risk individuals, blacks, people of the black race, black origin, Nigerians, Africans, we're all in that group of people. So we need to keep checking. We have a way more higher risk of getting glaucoma compared to other individuals who are either Caucasian or other races. Being over the age of 40 years is another risk factor for glaucoma. Okay, so kindly get your eyes checked annually once you get into that age bracket. Individuals who have a positive family history, either you have a mom, a father, a brother, or a sister, okay, who has glaucoma, a first degree relative increases your risk by almost up to 4 to 8 times, okay? So that's important for you to note. Anyone who already has an individual in their family who has glaucoma or has gone blind from glaucoma, please, you belong to the category of people who need to keep checking until you get because you could get affected without even knowing, and it's too late. Not much can be done, okay?
Right.
So yeah, these risk factors are very important. There are so many others, but for the purpose of this discussion, very important for you to know. And in very simple circumstances of just a red eye, don't just go to the pharmacy to purchase a drug and start instilling in your eye. Make sure you see an ophthalmologist, because not every red eye is just a simple inflammation of the conjunctiva. It could be something that could involve the cornea, and the cornea is the part of the eye that you want to be very careful about. You don't want that structure being affected. This is a model of the eye, so that I'm not just talking medicine. I'm going to do a little bit of teaching here and explanation. The glassy round structure that covers the black circle in front of the eye is called the cornea. So this is the cornea. This is the structure that I don't want any form of assault occurring to, because once the cornea is injured, it takes so much for it to heal, and most of the time it heals with a scar, because you can see it's an avascular structure. So there's no blood in it, there's no water in it, it's so clear, okay? So we want to keep it clear so that good vision can occur. So that is for red eyes. I don't want this structure being offended or being at risk or being hurt, because once that happens, I have a problem, because I'm most likely going to be dealing with an eye with poor vision, and we don't want to have cases of blindness nor severe visual impairment. So yeah, red eyes, kindly see an ophthalmologist to make sure you get checked. Don't use traditional eye concoctions or medicine in your eye. A lot of people would say, okay, use your early morning urine in the eye if you have a red eye. That's a no-no. Please don't try that. Some people would say, go get breast milk from a mother who is breastfeeding and instill into the eye. Please don't do that. Very risky. You could convert just a simple infective process to a terrible blind eye. Is that okay? So don't use battery water, which I've heard some of my patients in the past say they used. There are substances in Nigeria we call kafura, which is some chalky substance like that that's put into the eye. Or some people even squeeze out the sap of leaves and all of that. Please don't use substances like that in the eye. You have a problem, get to your nearest hospital. You'll be referred appropriately to see an eye specialist and ophthalmologist who will check your eyes. So yeah, these are a little bit of the tips that we could offer you for now. Very quickly too, you may not even know if your two eyes are functioning properly. What you can do is close one eye, try and see if you're seeing with the other. After you've done that, you're seeing clearly, close the other eye that was open initially and see if you're seeing with the one you closed first. That's a very quick test to even know, are my two eyes even functioning properly? So that could also tell us if you're someone who needs to rush to get an ophthalmological test check immediately, or otherwise. So these are just a few tips for you here and there. Please ensure that you stay safe. Don't use dangerous, harmful substances in the eye. Your eyes are your best bet to see the world, to enjoy the world, to view the world. Without vision, it's very difficult to function. So protect your sight, protect your eyes, and I guess you'll be seeing more of me on the channel. Thank you.